Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Adenomyosis. Adenomyosis is more common in more than or equal to 45 years of age, and it is more common in multiparous females. Adenomyosis is seen in estrogen and progesterone dependent condition. Risk factors of adenomyosis. So, risk factors include tamoxifen induced. Levels of CA125 are raised. Management of adenomyosis includes total abdominal hysterectomy. Conservative management includes you can do NSAIDs, oral contraceptive pills or progesterone can be given. Levonorgestrel intrauterine contraceptive device causes endometrial atrophy. Gonadotropin releasing hormone agonists can be given. Endometrial ablation or resection can be done to remove the basal layer of endometrium. If the age of the patient is more than 45 years, then we can do transabdominal hysterectomy with bilateral salpingo-oophorectomy is done. If the age of the patient is less than 45 years, then transabdominal hysterectomy is done alone. Man
thank you and thank you for watching.